a seat.
Good afternoon. Thank you.
Okay, ma'am. I am Leia May Villena and I will be your nurse for today. May I know your name, please?
I am Milagros F. Villena.
Okay. Ma'am Villena, how would you like for me to call you?
Just call me Mila for short.
Okay, that's great. So, Ma'am Mila, I need to take information regarding your health and personal information for me to be able to help and assist you for today. So, but this will involve me to ask you several questions regarding your health and personal details. So, I assure you that all of your personal informations and details will be kept confidential. Is that okay with you, ma'am?
Yes.
Okay, great. Okay, ma'am, before we move on, I would like to ask your personal information. Please state your name and age.
Milagros F. Villena, 47 years old.
What is your address?
From Paharang East, Batangas City.
Contact number?
0916389516.
Okay, date and place of birth?
January 24, 1974 at Negros Occidental.
Okay, ma'am. What is your nationality?
Filipino.
Your religion?
Roman Catholic.
Civil status?
I'm married.
Educational level attained?
Masteral
Okay, and occupation?
Businesswoman.
Okay, ma'am. So, Ma'am Mila, how can I help you? Any concerns about your health?
I'm experiencing loose bowel movement for 3 days, abdominal pain, and vomiting.
Okay, ma'am. For how long have you been experiencing this signs?
It's almost 3 days. 3
Okay,
days.
ma'am, 3 days. So, I will be asking you, Ma'am Mila, more specific questions about your conditions. So, please, can you describe this abdominal pain, this bowel movement? Is your stool watery or what, ma'am? Are you...
My abdominal pain is sometimes it is on and off,
Okay.
and I experience abdominal cramps,
Is
and
your...
its stool is watery, and sometimes once a day I experience vomiting.
Okay, ma'am. So, did you had any fever on these past few days?
No.
Okay, good. Anything that you do that makes your condition better?
I drink Orisol sometimes, and also Orisol and what do you call this? Lugaw. Yeah, I always eat Lugaw, Orisol, and Gatorade to ease the my abdominal cramps.
Okay, ma'am. Anything that you eat or do that makes it worse?
When I eating solid food
Okay, ma'am.
like
Solid food.
guava and also milk. Yeah,
And
it
milk.
is very irritated when I drink milk.
So, ma'am, you're experiencing abdominal pain. So, tell me where exactly you feel the pain on your stomach area.
Yeah, below the below on my stomach.
Okay, ma'am. How frequent is your bowel movement?
2 to 3 times a day. Yeah, it is watery, and sometimes it has it's not green. It's not, the color is brown color.
Okay, ma'am. How frequent is your vomiting?
2 to 3 times. One frequent. It's only once a day.
Once a day. So,
Yeah.
on the scale of 1 to 10, 10 being the highest, how can you please rate your pain, the pain you feel?
7.
Okay, 7. So, how's your condition affecting your work?
I cannot go to my canteen to manage my people, and also I cannot do going to market and doing household chores. I cannot, and because I feel weak at the time.
Okay, ma'am. Now I will be asking your past health history. So, have done any surgeries?
No, yeah, when I do my tubal ligation,
Tubal ligation.
Yeah.
How about accidents? Had been to
No,
any
no, I cannot
accidents?
experience accident.
So no further injuries?
No, no.
Okay. How about maintenance medication?
Maintenance, none.
Okay, ma'am. So any allergies?
Yeah, I have allergy to my to foods like seafoods.
Okay,
Yeah.
seafood. So what reaction have you been
I
experiencing
feel
when exposed?
itchiness on my extremities,
Okay.
and then my eyes become redness on my eyes.
Okay, ma'am. How about any family members or relatives that has serious diseases like diabetes,
No,
heart disease,
no.
no, arthritis?
Yeah, it's my mother experienced arthritis.
Okay. Hypertension, ma'am.
Yeah, my mother
Okay.
also.
So, are you experiencing any excessive sweating?
Excessive sweet, no?
Okay, no. Your vision, how's your vision? Is it good? Any blurry sights?
Yeah, it's good.
It's good. So, how do you experience nose bleeding?
No,
Okay, no. Difficulty in breathing?
none.
Shortness of breath when doing normal activities?
No.
Okay, chest pain?
No,
Okay, ma'am. So, you've mentioned that you have abdominal cramps, loose bowel movement. Have you been have indigestion?
yeah, when I eating solid food, no hard food,
So-
like guava, yeah, and then meat, yeah.
Okay, meat.
Yeah, I feel bloated in my stomach.
Okay, ma'am. So, any difficulty in swallowing?
No.
Okay, ma'am. And you said that you have loose bowel movement. So, any presence of blood in your stool?
No.
Okay,
No.
good. Headaches? Do you
No.
have? Okay,
None.
none. Okay, good. So, can you describe, Ma'am Mila, how is your normal day?
Normal day when I awake in the morning, I do my household chores, doing plantitas, and also going to market.
Okay, how about during the bedtime?
During the bedtime, I open my Facebook account
Okay.
and watching the videos on my cell phone.
Okay, ma'am. So, please tell me what kinds of foods do you prefer eating? Any diet you have?
Soft diet, more on lugaw, and more on fruits.
Okay, do you eat when you're hungry or do you eat when you're bored? Have anxiety?
When I eat only when I'm hungry.
Okay, good. So, how many glasses of water do you drink each day?
7 to 8 glasses a
Okay,
day.
7 to 8 glasses a day. So, do you exercise?
Yeah, I do jogging early in the
Jogging.
morning and sometimes dancing.
Okay, is this for everyday routine?
3 times a week.
Okay, ma'am.
doing
How about
jogging.
sleep? Any trouble in sleeping patterns?
When in this I only experience because of my my abdominal pain, sometimes I awaken with that
Okay,
abdominal
ma'am.
cramps. Yeah,
But your regular sleeping pattern, how
I
many-
sleep on at 9 p.m. and I'm awake on 5
Okay,
a.m. in the
ma'am.
morning.
So that's 8 hours of sleep. So if you won't mind, are you taking alcohol, cigarettes?
No.
Okay, good. Are you taking coffee? Drinking
Yes,
coffee?
yes.
What kind of coffee?
Herbal coffee.
Okay, herbal coffee.
Once in the morning and one at afternoon
Okay, ma'am.
during
So,
merienda time.
okay. Are you regularly having schedule for checkups?
Checkups only yearly. Yeah,
Yearly.
checkup.
Okay, ma'am. What do you do for fun?
Doing plantitas and
Okay.
also Zumba. Yeah, I also
Okay,
dance
that's
in
great.
Zumba. Yeah.
You've mentioned that you're married, so you have children.
Yeah, I have 4 children.
Okay, and how's your relationship with your family and relatives?
Happy, we are close
Close.
relationship with them.
Okay.
Doing joke when there is a time
Okay.
of
So,
joke time.
really have great
Fun,
bonding.
yeah.
Yes. You've mentioned that you're a master's degree holder. So, any
Yes.
plans, any future educational plans?
As of now, no, because I already satisfied with my business,
Okay,
and
ma'am.
it is already good for income in my career.
Okay. Does your work good? Your co-workers are fine?
Yeah, I manage my canteen, and they are doing well. They are very cooperative.
Okay. So does your income meet your family expenses, your family needs?
Yeah, yes.
Okay, that's
So,
great. So anything that you do to manage stress and anger?
I divert my attention with sometimes I doing Zumba, yeah. Zumba, and also pray. I also doing
Okay.
prayer and yoga.
Yoga. Okay, that's great, ma'am. How about, can you describe the safety of your environment at home?
In my home, I have my CCTV camera on
Okay.
in every corner, and in our village, we have also security guard to
Okay,
secure
ma'am.
our environment.
So, you've mentioned that you're a Couples of Christ member, an on and off member. So, what gives you strength and hope in life?
To all my children, they are graduated, and I always pray to Almighty God to have a good life, for them.
Okay, ma'am. So, okay, I guess that is the last questions I have. So, I would like to sum up the information that you've given me. Because if I got some of it wrong, can you please correct me? Is
Yes,
that okay
yes.
with you, ma'am?
Yes.
Okay. Name, Milagros F. Villena, 47.
Yes.
From Paharang East, Batangas City.
Yes.
Contact number 0918-638-9516.
Okay.
Date and place of birth, January 24, 1974, Negros Occidental. You're Filipino, married, Roman Catholic,
Yes.
graduate of Masters,
Yes.
and you're a businesswoman.
Yes.
So, a Couples of Christ member for almost 10 years, on and off member. So, you're experiencing on and off abdominal cramps and vomiting for almost 3 days. Have loose bowel movement, watery stool, and also experiencing dizziness, but doesn't have any fever. And you drink Orisol or Gatorade and Lugaw to make it better, and milk and hard foods make it worse. You feel the pain below your abdominal area, below your stomach, and you vomit for at least one time a day, once a day, 3 to 4 times bowel movement each day. So, no past injuries, accidents, and surgeries,
Yes.
except from your tuba ligation.
Yes.
And then, no maintenance medication. Have allergies on seafood, and you take cetirizine as medication. So, your mother have history of hypertension
Yes.
and arthritis. So, other body systems were good in condition except that you're experiencing abdominal pain, vomiting, loose bowel movement, and sometimes indigestion. And when eating hard foods. So, prefer soft diet, drinks 8 glasses of water, 7 to 8 glasses.
Yes.
Does jogging and Zumba for exercise, enjoys going to market, taking care of plants at home,
Yes.
and sometimes dancing. So your sleeping pattern was not that good when you have this condition.
Discomfort. Yeah.
Yes, you have discomfort in sleeping because of your abdominal cramps and this bowel movement. You don't smoke and drink alcohol. Drinks herbal coffee in the morning and afternoon. Have annual checkups. Have a good relationship with the family. Work is fine and income meets the needs of the family.
Yes.
And you practice yoga and praying to relieve your stress, and sometimes have bonding with your family and children. Have safe environment at home, and you're getting your strength to by praying to
Yeah,
Almighty God.
Yes.
So, is there anything that else you wanted to add, Ma'am Mila,
Uh,
before we move on?
add about my
Informations?
informations.
Yes, do you want to add something?
No, it's already okay.
Okay, thank you, ma'am. So, well, now I have to check your vital signs and examine you before we proceed and decide with what's going on with your condition. So, I will prepare you to our doctors in duty for further notice. I will assure you that I will be back as soon as possible to assist and alleviate your feelings and stress. So, is that okay with you, ma'am?
Yes. By the way, can I ask who are our doctors on duty that specialize in my
Okay,
situation?
ma'am. The time is now 2:12 p.m. I believe Dr. Magnaye is on duty.
Okay.
Okay,
Okay.
ma'am. So, ma'am, for a second, if you don't mind, is there any, I forgot to ask, is there any cultural practices that you apply with your family so I can note it down and so that the hospital and our physician will consider it in our medication process? Any cultural practices? None? Okay, that's good. So, yeah, that's all, Mamila. I will be back soon as possible if Dr. Magnaye had already responded to my assessment with you. So, thank you, ma'am.
Yes.
And yes, wait for me here.
Yeah.
Okay, ma'am. Thank you.
Thank
and
you.